before, and this is Mr. Ahmed Faisal, and you are the junior doctor on gastroenterology clinic. A 72-year-old man with a history of hypertension and diabetes and chronic liver disease due to hepatitis C. Admitted two days ago due to progressive fatigue and near fainting. He was found to be anemic. With further questioning, he admits, so this is a typo, he admits recent history of dysphagia. EGD and colonoscopy have been discussed, and you were asked to get a high-risk consent from Mr. Ahmed for both procedures. So this case appeared in Barnet Hospital in the last night, and some doctors get a full mark and some doctors get a very bad mark, although this is a straightforward case. Okay. So Dr. Ayan.
Yes, sir, I'm just moving on.
Okay, just prepare, take 1 minute, 2 minutes. Okay, then we can start. Again, I want everyone to write in a paper that what will be his approach. So please, doctor, just a reminder, our next week will be the last week to join our course. So if you are planning, please don't contact me in the last 2 days before the course and decide to join us, because sometimes I'm very shy to tell anyone that no more seats. But please, doctor, because we want to adjust the numbers, okay, to give the chance for practicing and this stuff. So please, if you are planning to join us, okay, our course will be 14 days, and some days of we will practice cases. Every day we practice cases, we discuss algorithm. It will be about 5 to 6 hours a day, but there will be a record will be available for every lecture for 48 hours after the lecture. So if you missed it on the live, you'll be able to watch it for 48 hours. Okay, anytime you have. So it will be a flexible at times, because I know it's difficult for anyone to attend all this time. Sometimes there will be praying in between. Okay, but within 14 days, we will discuss station 5, we will discuss history, we'll discuss neurology, and we will discuss the communications. So you will prepare yourself for everything except for sure for cardiology and respiratory and abdomen, which is the clinical. But in the clinical, we have 2 days that I will discuss all the neurology with some videos. Okay, this will be helpful in the neurology to prepare you before your clinical course attendance. Okay, so if you are interested, please contact Dr. Mahmoud on the page on the Telegram group or WhatsApp group. Contact him and please book your seat early so we adjust ourselves, okay? It will be about 14, 16 days. If you are not sure yet, please watch our reviews to know the opinion of others. If you like the way we are discussing, the way we approach the PACES cases, if you are new in the PACES, okay, this will be a very nice and good start point to give you an idea about what the PACES is and how to prepare yourself for the exam while at home. But please, my advice, don't join us if your exam after 15 days, because you will have no time to review what we will discuss. Okay, just at least you need 1 month before your exam, at least. Okay, I would prefer of 2, 3, or 4 months, so you have a time to watch and memorize the way I am discussing the topics and to remember our algorithms. Okay, watch our videos on the YouTube. It will give you a great idea. There is a lot of algorithms there, about 10% or 15% of our algorithm, and at least this will give you an idea about our system. So Dr. Ayan, can we start now?
Yes, sir. I'll mention my name as Shamim.
What?
Shamim. Yes.
Shamim.
Yeah.
Okay, sure. Dr. Shamim. Okay. So let's start. Okay.
Hello, good morning.
Good morning, doctor.
I'm Dr. Shamim, one of the doctor in the bowel clinic today. Mr. Ahmed Faisal.
Yes.
Mr. Ahmed Faisal, may I confirm your age, please?
Yes, I'm 72, doctor.
Okay, thank you very much. So, Mr. Ahmed, I will address you. Ahmed, is it okay?
Yeah, yeah.
Yeah. So, Mr. Ahmed, we are here to talk about your health condition and
Mhm.
uh, and what we have further plan that we are going to discuss today. So, before I start discussing with you, just I want to know how much you know about your condition and what's going on. Can you tell me briefly about that?
Yes, doctor. I felt very weak and I have a lot of fatigue recently. And yes, I was going to fall down with fainting. And at that time, I came to the emergency.
Right.
Okay, and then they told me that I have a weak blood, and then they told me that they may go further in my management with doing some procedures. And I think you are here with me today to discuss that with me, correct?
Yes,
I
that's
have I have high blood pressure and I have diabetes since years,
right.
and they told me that I have problem in my liver, but I think it's going okay because I have infection in my liver, hepatitis, since about 20 years.
Right. Okay. Mhm. Okay. So as you rightly said that you have having some fainting attack, and we found that your hemoglobin, what you call the blood in your body, is low, right?
Yes,
And
yes,
it has also mentioned that you have been suffering from difficulty in swallowing also as well.
yes, doctor. Recently,
Right.
also, I found that swallowing is a little bit become not easy.
Right. So, so Mr. Ahmed, would you like anybody to be else in the meeting, or you are comfortable alone?
Again, doctor, please.
Would you like anybody else with you in this meeting, or you are comfortable alone?
No, I'm okay, doctor.
Okay, so thank you. So just to start with, as we have found that you have been low blood and also you have this difficulty in swallowing, and you are also having some liver problem because of this infection, hepatitis C, and also your other disease like hypertension and diabetes. So
Yes.
we are very concerned to find out the cause of this your anemia, this low blood in your body, and also why you have this swallowing difficulty. So for this reason, our team has decided to do a camera test for you. Are
Camera
you,
test.
yeah, are you aware of this?
Yes. I don't know details about that, but tell me more, doctor.
Okay. So basically, there will be two types of camera test will be done because we don't know the source of if there is any bleeding under your food pipe, either it's from the upper part or from the lower part. So we have to do two types of camera test. One is from your mouth, another one is from the back passage. Okay, and this camera test will be done by the specialist doctor who has done many these procedures for many times, and it is quite safe in his hand. Okay, and the most important thing about this camera test that we will find the exact cause for your low blood and for swallowing difficulty, and we can manage or we can give you treatment accordingly. Right? Do you have any question at this stage?
Still, okay, tell me how you will do that, doctor. I think it will be very painful thing.
Right. So I'm going to explain you. I will draw a diagram for you. First, I will draw this upper part. You see, this is your mouth, and this is your food pipe. Okay, and this is your food bag. So there is a
Mhm.
small tube like pen size, which has a camera attached with this. Will insert through your mouth. Okay, and it can go to your tummy. Right. And if anything we found that any suspicious of any abnormality, and if we found that there is any kind of bleeding or any leaking of the blood from any things, we can give the treatment as well. Right.
Okay.
Okay, and the another form is also the same, but it will be passed through a back passage and the same kind of tube, and it will be passed to see the lower part of your foot pipe. So we can visualize and also can take a snip from it, and we can exactly find out the cause of what's wrong with you, where is the source of the bleeding, or why you have this swallowing difficulty. Okay.
Okay.
Okay, so as I told you already, importance that we can find the cause and we can manage it accordingly. Uh, there is, are you with me, or you would like me to further explain these things?
Yes, I'm following you, doctor.
Okay, so this, as I told you, this will be done by the expert procedures, and it has various benefits. I also have to explain you what if it is not done, right? So if it is not done, uh,
Mhm.
we couldn't find actually why you are having low blood, because maybe somewhere leaking and couldn't find the cause. And if we couldn't find the cause, we cannot treat it. It will be continuously leaking, and I'm sorry to tell you, it will cause serious complication and even the death also, right? And also for the swallowing difficulty, if there is any growth is there or not, we are not sure about that. And so we can detect it. If we don't do, we cannot detect it. So these are the benefits of this test. And as I told you, this will be done by expert's hand and all precautions. Your concern was that it will be painful. So we will give you some numbing agent so that you shouldn't feel the pain. Right. And as every procedure has is some side effects, so there are some minor side effects that I would like to tell you as well. So
Mhm.
it's a procedure, as you said, sometimes it can cause discomfort, but we'll take care of this by giving you appropriate painkiller or pain management. Sometimes it can cause the bug infection also, but very rare chance, and we will take all aseptic precautions so that it shouldn't be happen. Another thing that because is pipe is going the food pipe, if the your food bag is not very strong, and it can rupture also, make a small tear as well. But these all complications are very rare, and we are also ready to handle this complication if it occurs. So why we are want to do if there is so it's still negligible, but still the complications are there. I'm sorry,
Mhm.
are you with me?
Yes.
Yeah, okay, thank you.
So it looks like a
So,
very dangerous procedure, doctor. Is there a possibility of bleeding till death?
well, as I told you that there is this complication. Yeah, it can make a small tear in your foot pipe, and is a chance of bleeding as well. But all these complications are very less, and you will be managed by expert's hand. And if even if this can occur, we are ready to handle this with our expert team. But the importance of these things, okay, why should we do, even if there is, though the minor complications, but we need to do is why? Because if we don't we don't couldn't find out the cause. And if we couldn't find out the cause, we cannot manage you. And we don't know where you are from bleeding, and you will continue to bleed, and that will cause also serious complications in yourself. Are you getting with me?
Yes.
So what do you say about that?
I'm still worried about that, doctor. It looks like something weird, and I'm worried to bleed to death. And they told me that with my liver problem, there could be a possibility of severe bleeding. So, doctor, I don't want to do that. Please give me any other option that I can do, please.
Well, I can understand your concern, and I can appreciate your worries also. But
Mhm.
you see, Mr. Ahmed, without the knowing the exact cause why you have this low blood count, it is very difficult to treat you, because we are just blindly treating you with might be no benefit, and your conditions might deteriorate. That will again land up you in a complications, and that complication can also result in death as well. Are you with me, Mr. Ahmed?
Yes.
And as I told you, yes, you are correctly right. There are some chances of bleeding, but we are there to help you regarding that. But we have to, if something happened, the team will be there. We can give you some corrective measures. But yes, there is some risk that, and we have to actually compare.
So
what is
give me the other, give me the other options, doctor. I don't want to die with this procedure. So tell me what other option that you can do for me. If what if I refused?
right. So other options are there that we can do by only this CT scan and this, but we can only visualize that what is the problem is. We cannot treat by that well by these things. And the best procedure or best thing, it is in your best interest, is
2 minutes
decided by
remaining, doctor.
by
Two
our
minutes.
consultant team. So just like to ask few questions about your home and lifestyle. With whom do you live?
Yes, I'm living with my daughter.
Okay, and how's your daily activities? How you're coping with that?
Yeah, with recent this weakness and fainting, I can't do the gardening of my garden anymore, doctor. I'm very tired most of the time, so I am not as before.
Okay, and do you smoke?
Yes, doctor, I am a heavy smoker.
I'll highly recommend you to stop smoking because it will be beneficial for your health. And if you want, I can refer you to the smoking cessation clinic. And what about alcohol?
I'm not drinking alcohol, doctor. They told me that this is very harmful to my liver, so I'm not drinking alcohol anymore.
Yeah, that's good. Okay. So just like to again emphasize that as I understand that you are very much worried about your bleeding problem. So, but otherwise also we cannot help much. There are investigation which can only maybe we can find out the what is the cause. But if you found that there is bleeding inside your foot pipe, we cannot stop by other measures. Are you getting with me?
Yes, doctor.
So, what do you say about this? Still, you want to go, or you have any question or concern about this procedure?
No, doctor, I'm still not comfortable to proceed in that.
Okay, so I will just involve my consultant to have a chat with him. Okay, so
Mhm.
he will explain more about this, and also I have to ask you how about your mood?
My mood?
Yeah,
It's bad, doctor.
are you feel depressed?
Yes, I'm worried about what's going on.
Okay, and do you enjoy the daily activities what you used to do?
Yes, doctor, it's okay.
It's okay. Okay, do you think life is still precious for you?
Yes, doctor, it is.
Okay. So I'll just
Time,
conclude.
time, time finished, doctor.
Okay, okay.
I'm finished. Thank you very much.
Hmm.
Okay, so yes, doctors. Now again, I will be expecting you to give to Dr. Ann his score. Try to send it privately to me, then and give yourself a score, doctor. Then we will proceed to discuss your performance and to ask you the questions of the case. So now I will close the chat to make it with me. The score, Dr. Amran, is from 16. So give the score over 16. So some give you 15, some give you 14, some give you 10, some give you 12. So starting from 12 to 16. 12 to 16. Dr. Arwa insisting to give you the score from 20, but it's no problem. It is over 16. Okay, so just a second. Okay. Okay. So your score between between 12 and 16. This is most, or 11 to 16. This is what the most of the candidates gave you. Now questions, doctor. Okay, what is the ethical and the legal issues in this scenario?
Legal is consent. Ethical
Okay.
issues is autonomy. The patient has right to know all
Yeah.
information about his procedure,
Mhm.
why it is done, and he should take the decision whether he should
Yeah.
go for it or not.
Mhm.
Beneficence, the colonoscopy or gastroendoscopy has been decided in the best interest of the patient.
Yeah.
Null maleficence is avoiding another investigation which are not necessary and which will not be helpful in this condition.
Okay.
Yeah.
Mhm. And the legal is the consent. Did you tell
Consent.
the patient that he need to sign consent, or he need to sign refusal form, or the against medical advice if he refused that? Did you give him an idea about that?
Actually, I couldn't find time. My discussion was only for convincing him. Yes, if it
Yeah,
is,
but
I
don't you think
will.
it is important to tell him?
Yeah, it's very important that you tell, but I want to assess why he is not convinced. My first was that maybe he is afraid of this procedure, so I tried to convince him
So
how
why
important
do you
it is.
think, why do you think the time did not help you to do that? Why do you think that?
Mm,
You have a
because,
repeating problem?
sorry.
You repeated the things more than you should. What do you
Yes,
think?
yeah,
This
I
is-
repeat.
Did you
Yeah.
think, don't you think that you dig more deeper in the history? You spend the first 2.5 minutes with taking more history details, although there's not a history station. Okay, so let me continue asking, what do you think if this patient still insisting not to do the procedure? What's your action?
My action is first to try to convince him and involve the consultant also. And I also try to assess him whether he is capacious or not. That's why I asked him about his mood and his interest in the life. If any point of time I found that he is not interested in life and he don't have
No,
some.
he's the opposite. He's very concerned about his life, and he's worried about his life. That's why he's worried about the complication. So it's not about, he didn't say that, hey, let me die. He said, I'm worried about bleeding to die, so, or
Yeah,
bleeding to
yeah.
death. So
No,
he's
I didn't found, but I just assessed him that up to what level he is depressed.
okay. So he said, you said to him that we are going to do this procedure, and we will know the exact cause of your symptoms. Do you think this is a correct sentence?
Yes,
It is a correct one.
yes.
Okay. So what if you didn't find the cause by these procedures? I mean, you did the colonoscopy and the EGD, and you still don't know the cause of the patient anemia. Okay, and then you will sit with him again, trying to convince him to do another procedure for further, to do MRI, for example, or to do CT, for example. Okay, and you told him before that we are going to know the exact cause of your symptoms. Do you think it was a good idea to use this sentence with the patient?
I think if the anemia, patient is having anemia without a known cause, yeah, not 100%. Yeah, that's you're right. Yeah.
Okay. Okay, doctor, what other alternatives for these procedures you know?
There is capsule endoscopy. There is MRI enterography, CT
Mm-hmm.
enterography.
Mm-hmm.
Yeah, these are the
Did you hear
other.
about something called Cologuard?
No.
Okay. Thank you, doctor. Thank
Okay.
you. Okay, so thank you, Dr. Ann. That's why I tried to be as silly as the examiner with you. Okay, so don't take it personal.
No, no,
Okay.
no, not at all. Thank you, sir.
Yeah, but I would advise you, first thing, never argue with the examiner.
Okay.
You know what I mean by that? I mean, we are here to learn, okay? So if he told you that I mean, you need to think about why he is asking the question. So if he asked you that he didn't like, it looks like he didn't like when you said we are going to check to know the exact cause. So you shouldn't say yes. You shouldn't say yes, it was a good question. Because if
Mm.
it was a good question, he will not highlight that. So he is giving you a chance to change your mind.
Mm.
He
Yes.
didn't like that, and he's giving you some chance to show your idea or to know your mistake. You know what I mean? So
Yes.
this is another, it's the same as in the clinical station when sometime the examiner will tell you, did you have, is it a regular pulse? You will say, yes, it's regular. He may tell you, okay, can you go and recheck it? Some candidates say, no, I checked that already. And this
Mm.
is wrong. He's giving you a chance to recorrect yourself. So don't miss this chance, please.
Okay.
So when he asked about this question, he didn't like it. That's why I'm saying these simple case, but bad scores for the doctors because they will catch any one small single mistake. When the case is not tricky, when there is no trick in the case, it's about the perfect performance they are expecting. Okay? So the other thing that you spend the first 4 minutes talking alone, you are just speaking and he's not there, maybe he start to play in his phone. So you need to keep checking his understanding and that he is following you. Then you suddenly remember that there is somebody in front of you. So you need, hey, do you follow with me? This follow with me needs to be every 30 seconds, maximum 1 minute. Okay?
Okay.
Okay. That's it. So yes, Dr. Samer agree with me. He said you are totally right. It happened with me 9/16. So don't argue with the patient. This is the first thing. And the other thing, the consent here, when he said the time management is your duty. So don't say that I didn't have time to mention the consent. Okay, because you should manage your time. You shouldn't keep repeating and going deeper in the history, then you have no time to discuss a very important thing, which is the consent. And the patient should know that he will sign if he refuses the service. Okay? So these are the points. Otherwise, I like the confidence, I like the fluency, and I like that you didn't stop speaking, and your topics with all the title are relevant. So you did a good job, but this is not the perfect. The perfect, you need to remember that there are some points that you would never forget in this type of cases. That's why we will discuss in the coming minutes how to approach these type of cases. Okay?
Okay.
And I think this will be very helpful. Thank you very much, doctor.
Thank you. Thank you.
Okay? Thank you, doctor. So now I want everyone to look to this slide, and this will make it very easy for you. Okay, so there is doctor said how to tell it is a high risk consent. Once you go to the point of consent, doctor, tell him there will be a consent. You shouldn't say it is high risk consent, but you should show that when you are discussing the complication, you need to be honest and tell the patient that because of you have a higher risk of bleeding because of your liver problem, this is considered high risk consent. So the examiner will expect that you highlight this to the patient. There is two problems with this patient for colonoscopy. What do you think? There is specific things in his condition. What do you think, Dr. Ahmed? Did you close your mic? Dr. Ahmed, I will open your mic again. Tell me, there is two specific things in these cases, and the doctor who didn't mention that they lost some marks. It was about what?
Yeah, it's chronic liver disease, and
Yeah,
also
chronic liver disease. Maybe he is maybe he has thrombocytopenia and he has a higher risk of bleeding. And the other thing will be, did you mention anything about the preparation for colonoscopy?
No.
So that's why you need the coming slide. You need to mention that what to prepare before the colonoscopy. And the problem with these patients, when you put them in dehydration, they may develop dehydration while preparing them, then they may be in a hepatic encephalopathy, for example. So the examiner will expect you to go deeper. As I told you, everything in the scenario is there for a reason. So the chronic liver disease is there for that. It looks like a simple case, but it is not. You will lose marks because of that. You need to highlight why this is a high risk and why he is more exposed to complication. And he need to understand because he need to make his choice. And you need to show him that although there is a great risk, but also there is a great risk if we left you without a definite diagnosis for that. Do you agree with me, Dr. Ayan?
Yes, sir.
Okay, great. So let me show this slide. I know you are all tired and you all came back from work. So let's go fast. Then these details I can discuss in another day. Explanation of any procedure. Usually, this is my pages. This is Dr. Tan pages in our communication course. Okay, we start by hi, identify, and how. Hi here mean hi, how are you? I am Dr. X. Okay, are you Mr. Blah? Identify mean your name and your age. Then how are you today? Then why we are here today, okay, and what do you know and what do you expect about our meeting today, for example. So this, just to remember it, it is hi, I identify, and how, why, and what. These questions always cover the first part and the introduction of the interview. And again, we will go through that in the coming lectures. Then I will tell you exactly about this slide. There is before, during, and after. And when you just remember this, and this is the system I want you to follow in the communication. I don't want it to be like something vague for you. I want you to go to the exam and you remember these pages so you will never miss one point when you discuss that. Don't give the examiner any chance to cut any mark. So for any procedure, believe me, you will not find this slide anywhere else. I prepared it myself. So before, there is indications. So you will start by explaining the indications. So you ask him about what he know and what he expect about his condition and how are you today and this stuff. Then you start your mission. Don't waste time to go deeper in the history because this is not a history station. Then we are here today to discuss your need to do a camera test. And you start as the doctor did, you start by drawing. Draw for him what's going on and what's possible and what we are going to do. Okay, so this is the indication. So you may draw during describing the procedure and during showing the indication. Then the investigation. So remember what we need to do before the procedure. So why you are doing the procedure, this is the indication and you can draw. Investigations, we need blood work, we need to do something CPC, we need to do the coagulation factors. Okay, sorry, we need to do the coagulation profile for the patient. We need to see the platelet counts. We need to know the general condition before going his electrolytes. Otherwise, this patient may be complicated by hepatic encephalopathy, or maybe this patient platelets is 20,000. Will you proceed to do that without giving any platelets? It is dangerous, correct?
Yeah, right.
Then preparation. You need to discuss the preparation. You need to tell him, we will give you something to drink the day before the procedure, okay? Then you will be fasting, okay? You will go to the restroom till your back passage will become very clear. This will help us to see inside your bowels, okay, clearly, okay? Then by the end of our discussion today, if you agree to do that, you will need to sign a consent. So this is what I need to remember, doctor, before the procedure. So I will not miss a very important things. So when I remember this page, I will not miss this stuff. Then during, what is the place of service? This will be done in a theater, okay? There will be a doctor who take care of the pain, or we will take care of the pain. We will give you some drug or some medication through your blood channel. This will make you drowsy or sleepy, so you will not feel any inconvenience. Okay, then you will start to describe the procedure. We'll go through your mouth, we'll go through your back passage, okay, and there will be a camera, there will be a rubber tube in the size of the thumb, okay, going inside, and we will be watching what's going on. If we notice anything abnormal, we'll take a snap. But as anything in the medicine, there could be some complication. In complication, there could be bleeding, there could be infection, there could be blah, 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 whatever what the procedure you are describing. Then you need to mention what precautions we take in case of complication. If there is any bleeding, we will have already prepared blood. Sometime we need to ask the surgeon to join us to help. This is with the expert hands. There is a tiny chance for that to happen. But because you have some risk factors, because your bleeding tendency is a little bit higher than the normal person, because of the problem in the liver, we will take more precautions for that in order to be ready to deal with this complication if it happens. Then after the procedures, you may stay with us for 6 hours or more, okay, under observation. Okay, then if any complication happen, we'll deal with that. And even when you go home, you will be aware of the complication that you need to look for. If there is a severe tummy pain, if there is a problem in your back passage, if there is any fever in the following days of the procedure, you need to contact us. The red flags. If there is any bleeding, the very severe pain, vomiting, throwing up, okay, then you need to mention that we will give you a schedule for your follow-up with us. So we will discuss with you the results and check if there is any problem happen with you. Then the lifestyle modification. For some procedure, you need not to do something like renal biopsy. You need to stop doing vigorous exercises, or you need to take rest. You need to, whatever, you need to drink more fluids after, let's say, something with contrast. You need to drink 2 liters or 3 liters of fluids. So lifestyle modifications will be discussed. So when you remember this page, you will not miss any of these. Dr. Ayan, how many things do you think you missed in this case?
Many things, so doctor.
This is why I'm telling you, I'm not blaming you. Believe me, I like your performance very much. But I mean, you are spending some time with us now in order to learn something. If you didn't learn something, so you wasted your time, correct? So if you remember this point, you will go out and say, hey, it was simple. It was just about describing a colonoscopy and EGD. And actually, the examiner will cut a lot of marks because you missed this stuff. So all these stuff are important. So it looks like without organizing way of studying for PACEs, you will not be able to know why you failed the exam or why you will not get a good marks or whatever. So you need to know the rules of the game. It's not about studying, it's about how to play the game. Okay, it's a game and there is rules. If you are fast, it is not enough. If you have skills, it's not enough. You should know the rules of the game before going to the match. Okay, that's why I'm trying to make it more simple for everyone. What if the patient's still refusing? And this is why I said, remember Risala. Risala, we will discuss in a separate lecture about when the provider, when the candidate, when the patient refused the service. They are referred to reason, the seriousness, the alternative, the legal issues, and the help. So all these, there is an approach of how to ask if the patient still insisting. So this patient refusing, and you need to start the Risala very early in order to detect why he is insisting. Maybe he has a previous experience with his cousin who died during colonoscopy. So if this is hidden in the scenario and you didn't ask, you will lose marks for that. And eventually he will sign the consent or he will sign the against medical advice, the refusal form, because he don't want to do it. And this is his right. And what if this is the daughter of the patient and she's the one who is refusing? And in this case, you need to highlight if the patient is competent. So this is his decision. If you didn't do that, you will lose at least 3 to 4 marks in this case. That's why I'm telling you, doctor, you need to learn how to play the game. Okay, simply in the coming slides, I will not go in details, but usually this is before how to ask about the stuff in before and during and after exactly, okay, and how to answer the patient when he start to ask all this question about any procedure. Okay, so remember, doctor, there is a rules in communication, please. And communication, doctor, don't just keep reading from books without practicing and without knowing what you shouldn't miss. If you missed anything of these, you lose marks. I was shocked with some candidate. In this case, they get 4/16. They told me they want to join our course. They want, okay, and they said, hey, we did the case very well and we don't know what the problem. That's why I told them, okay, just attend our free lecture and they will show you what the simple things that when you miss. And some doctors who attend the course and they still think that these points is not important. But believe me, every point you may miss, because I did a condensed slide. It is condensed one. So every one single point I'm discussing will be important and you will lose marks if you missed it. Okay, so instead of reading 100 pages anywhere in different books, just study this page, start to practice it, and inshallah, you'll just clear the case. Okay, so that's it, doctor, for today. I hope you enjoyed that. I hope you learned something. It was about vasculitis. It was, this case appeared in 3 centers, okay, and the other case of vasculitis, 3 centers in UK and 2 centers in the international. So these are common cases. So please, doctor, if you are interested, okay, of our course, please, for diet 1 or diet 2, okay, please join us, call Dr. Mahmoud and make your reservation, because next week we will close the booking for our course. Okay, and good luck, doctor, for any I'm ready for all your questions if you want.
Sir, just explain Risala sir in little more detail. Risala.
Yeah, Risala, we have a lecture for the refusal, but for just to know reason, Risala is reason, the S, seriousness of refusal, the A, alternatives, the L for legal issue. He should sign that he refused, then the help. What type of help you will offer him if he refused. If the patient refused to take something or do some procedure, you still need to help him. Anything you will miss in Risala, you will lose marks. And there is a technique I will teach you when you offer the alternatives, because some mistakes you do in offering the alternative will make you lose the station. Some candidates, some examiners will be very upset if you give the patient alternative that against the consultant will. I mean, the consultant sent you to discuss with the patient that he needs colonoscopy, and you give him alternative to do the CT, and the patient choose the CT, so that the consultant will be very unhappy. So be very careful. I will tell you the technique for that, to be carefully doing that, okay, without making the examiner and making your consultant mad of you, okay? Because you need to give the alternative, but with very strong highlighting for the disadvantage of taking this alternative, okay? So we have a full lecture for the risala and refusal. We have a full lecture for discharge against medical advice. We have a full lecture and the same style of slides for medical errors, complication, and negligence, okay? And the difference between all of these and how to approach this in the exam. Okay, so all these details and communication we discuss in over 5 days in our course. There is 5 days, there's 30 hours of communications with all these slides during our course. So please, doctor, if you are interested, join us in our course, join our Telegram group, our YouTube group, okay? Any question before I leave? I sent on the Telegram group the 20 cases that appear recently in the PACES. So please, doctor, if you have a near exam, take a look for these cases because they keep repeating in the same diet. So these 20 cases in our Telegram group, take a look because they appeared many times in the last diet. So just watch them, ask your question, prepare yourself. Okay, don't worry about PACES, enjoy your life. PACES is not difficult, it's a game and you need to learn how to play the game. Questions before I leave? This was Dr. Tan with you, okay? If you need any help, just contact me privately. If you need to join our course, contact Dr. Mahmoud. Thank you, Dr. Raja. Thank you, doctors. Did you find this helpful? Did you find the things for the communication helpful?
Yes, sir, very much.
Thank you, Dr. K. Thank you, Dr. Ayn. Thank you, thank you, thank you. You all send me privately. Thank you, Dr. Galaxy. Thank you, Dr. Khalid, Dr. Amran. Yes, there is 20 cases, doctor. I sent on the 20 cases I sent on the Telegram group. So go ahead and go through these cases because it may appear in the exam. I'm trying to collect the new appearing cases, okay, and try to discuss them week by week. But starting from the next week, unfortunately, I'll be very busy in the course. So I will try to do something free. But eventually, if you are planning to join the course, because in the course, I have no time to do free lecture during the days of the course, okay? Dr. Shafkat asking what alternative we can give here. There is what's called Cologuard. This is a blood test. The Cologuard, we do it when there are no risk factors. So if the patient asking you about, wait, doctor, wait for this point, please. This is important. For the Cologuard, this is a blood test we do. Okay, and we do there is a guidelines for the Cologuard when the patient has no risk factors. I mean, the patient is 70 years old and the freezing colonoscopy, the patient should have no bleeding, no anemia, nothing. It's just a screening. So in this case, we allow them to do the Cologuard. But with such patient with severe anemia, with dysphagia, Cologuard will not be alternative at all. So you need to have some idea about this. If the patient asking you, I hear that there is a blood test to exclude cancer colon, why you still insist to get money by doing this camera test for me? Okay, so you will get an idea about this. Usually they like in the exam to ask about the new techniques. It is not very new, the Cologuard not very new, but they like to ask about the deep brain stimulation. They like to ask about the stool transplant for Clostridium difficile, okay? So they like to ask about these new techniques and new medications. Okay, doctors? Waiting to see you soon, waiting for your questions. If plan to join our course, contact Dr. Mahmoud, and good luck, doctor, and best of luck for everyone. And congratulations for all the doctor who passed, and best of luck for come in the next time if anyone didn't get the chance to pass this time, okay? Dr.